everybody, it's Dr. Joe, and today I'm going to show you some isometric exercises for the hips and the knees. And the folks at Active 5 sent me a really cool tool to help you track your progress. So let's get started. Disclaimer alert, disclaimer alert. Some patients ask me, how hard do I need to push, or how do I know how hard I'm pushing with isometric exercises? Because isometric exercises are when you are pushing, you're activating those muscles, but you're not actually moving the muscles. So for instance, if I wanted to do my leg out this way, I would be pushing into something where I'm activating that muscle but not making that movement. And the reason these are important is because a lot of times right after an injury, or especially after surgeries, you're not allowed to do certain movements, but this is a great way to start strengthening those muscles before you can do those movements that might be precautions. So a great way to know how much you're pushing is to use specific tools. This is called the Active 5, and it's a really neat piece of equipment because what it does is you download the app on your phone and it'll show you how much pressure you're putting on this. So you basically put it wherever you're pushing into and it'll let you know. And the app has some really cool games you can do with it, and what you do is you put your max rep in there and then it'll give you a line you have to follow, so you push harder and less, which is really cool. So what I'm going to do is just show you some of the isometric exercises and use this throughout so you can see how to use it. To start off, we're going to strengthen the quad, and this is a simple quad set. If you've ever had physical therapy for anything in your leg, you probably know what a quad set is. I like having a little roll or something underneath the knee to give you something to push into. You don't have to, you can push on the ground, but I feel like this helps you out just a little bit. So you can roll up a towel, you can use a little noodle, anything like that. But what I would do then is just place this right under your knee on that towel or roll. So what you want to do is this quad muscle, you want to activate that muscle, squeeze it, so you're trying to push that knee down into the floor. So just squeeze. You should see that muscle activate a little bit. If you've had an injury or surgery, you might not get a whole lot of contraction to start off with, but you're trying to push that knee down as hard as you comfortably can. Hold that for about 3 to 5 seconds while you do it, so you're really getting that muscle working, and then relaxing. Just start off with about 10 of these, and if you're using the Active 5, you can follow along on your phone, and so you can push a little bit harder, relax a little bit, just to get different activations of that muscle. The next one is going to be a hamstring set, and the way to do that pretty easily is bend your knee up and put your heel down on the floor. So again, I would just place my heel on the Active 5, and then you're pushing down, activating those hamstrings underneath. So again, you want to push as hard as you comfortably can for about 3 to 5 seconds, and then relax. And then what's really neat about this is you'll be able to track your progress and see how much you're getting stronger. So sometimes you're like, I don't know, I feel like I'm pushing the same, but then you can actually have visual results to see that you're getting stronger and pushing a little bit harder. So again, holding for 3 to 5 seconds and then relaxing. The next one is going to be to work the outer side, going into hip abduction, AB abduction, going out. And that's working those outer muscles, those glute muscles. So a great way to do that is just take a belt or a strap and put it just above your knees on the thigh area here. Put your feet flat. You can lie down, especially if you've had hip surgery. You might not want to break those precautions, so if you want to lie all the way down, that's fine to do as well. But again, you can take this and just place it on the side here, and then you're pushing out into the belt, like you're opening up like a butterfly. So again, 3 to 5 seconds, just starting off with 10 times doing that. And you should feel those muscles on the outside, that abduction activation. And then after you get 10 of those, you're just going to go into adduction, which is squeezing in. So that's those inner thighs, the adductors, the groin area. And then so same thing, sometimes I say put a ball or a pillow in between, but you can just hold your hand in the Active 5 and then you're squeezing in. So same thing, just 3 to 5 seconds and then relaxing. and then starting off 10 times, but eventually you can kind of work your way up. But making sure that none of these hurt, they shouldn't be painful, especially if you've had that surgery of some sort in your knees or in your hips. You want to make sure that you're doing a comfortable push, but you're strengthening those muscles. So those are your isometric exercises for the hips and the knees. If you'd like to purchase the Active 5, click up here. And don't forget to subscribe to our channel by clicking here. So remember, be safe, have fun, and I hope you feel better soon.